Comparative analysis of intraoperative and imaging features of invasive growth in pituitary adenomas by Ladik et al. Background: pituitary adenomas are usually benign, but can sometimes be invasive. This denotes a negative outcome usually. MRI and intraoperative analysis are used to assess the invasive growth, but comparative findings regarding clinical factors are limited. The aim of the study was to address the lack of MRI and intraoperative findings regarding pituitary tumor invasive growth in a clinical setting. This was a retrospective single-center study with data between 2004 and 2018 analyzed. Patient age at diagnosis, gender, histopathological diagnosis, extent of resection, surgical reports, and MRI findings were looked at. MRI findings closest to surgery were then assessed. Coronal post-contrast enhanced images were used and graded. Statistical analysis was then done using univariate and multivariate analysis. More patients had macroadenomas, with somatotroph adenomas being the most common type. Intraoperative estimation revealed a higher rate of invasive masses compared to MRI analysis. Complete resection was achieved in 80% of adenomas. 24.3% of cases had cavernous sinus invasion or CSI on MRI. CSI was more common in patients older than 45. Adenomas suggesting CSI were incompletely resected at a significantly higher rate than adenomas without CSI signs. 42.4% of cases showed invasion on intraoperative assessment. More often this was seen in patients older than 72. SGSAs and SGCAs were more invasive subtypes. Invasive growth by intraoperative assessment led to a significantly higher rate of subtotal resection. Conclusion: both intraoperative and MRI signs of invasive lesions have a high risk of incomplete resection. This occurs more in older patients. SGCA, SGSA, and gonadotroph adenomas have a high rate of invasion. To read the full article, please scan the QR code.